This video is about chunking and checking when giving advice or information to patients. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. In most healthcare encounters, there will be a point at which the practitioner will need to give advice or information to the patient. This information can be quite overwhelming for several patients in this clinical healthcare environment. To make this easier for them to understand and take the key information away, it's important that we break up the information we need to give into smaller, more manageable chunks, hence chunking. We then need to check that the patient has understood the information that we have provided. Hence, chunking and checking is a really essential skill in a healthcare consultation. Let's watch a short clip that demonstrates some of the skills of chunking and checking.
In this next snippet of a consultation, you will see how the practitioner provides quite a lot of information to the patient about his new drug, and then at the end checks the patient's understanding.
Let's start with the Simvastatin. Okay, so Simvastatin is a 40 milligram tablet, and this tablet needs to be taken at night time. And the reason we take it at night time is because we make most of our cholesterol when we're sleeping. And I see you have a normal 9-to-5 job, so you're normally sleeping, I'm assuming, overnight. Yeah. So what we'd like you to do is take it just before you go to bed, because then we're going to get the most benefit of this working when your body's normally making cholesterol to help cut down the amount of cholesterol that you're making.
Okay.
How do you see that fitting into your normal everyday life?
It should be okay. So take that last thing at night. Yeah, it should be okay.
Okay.
Yeah.
Where do you think you'll keep it?
Where do you keep it with medication drawer, in the medication drawer?
Yeah, is that? I'm just trying to think. Is there a way that would help you to remember to have it at night time?
I can leave it upstairs in my bedside table, and that could be a reminder.
That would be a good plan, I think.
Right.
So if you keep that, do you go in your bedside table?
Yeah, because I leave my book in there. So just before I sleep, I tend to read, and I could place that right next to it just as a reminder.
That sounds like a good plan. So we're going to keep this with your book in your bedside table, because you're going to take it as a reminder to take it just before you go to bed.
Yeah.
I'll just tell you a little bit more about Simvastatin. Now, when you first start taking it, like all medicines, there may be some side effects.
Right.
Now, there's the sort of ones I say that mild. About 1 in 10 people say they get a little bit of stomach upset. Most people, it doesn't bother them. That disappears fairly quickly.
Okay.
The one I do want to tell you about is if you get any muscle ache. And what I mean by muscle ache is the sort of ache you get if you've done a day's gardening when you don't normally garden. Okay, so all your muscles aching.
Right, okay.
And so if that happens and you haven't done a day's gardening, you need to come back and tell us.
Okay.
And the reason for that is it's suggesting you've got your body's not getting rid of this as effectively as we want it to, and it's building up and giving you that sort of aching muscle symptom.
Right.
Okay. Does that make sense to you?
Yeah. Okay. Muscle ache. Okay, that's fine. It should be okay.
The other thing with this one is, do you have any grapefruit juice ever? Do you ever drink grapefruit?
I do drink some grapefruit juice. Yeah.
Yeah. How often do you have grapefruit juice?
A glass a day, first thing in the morning.
Right. Okay. That creates a little issue for us.
Right.
Okay. The reason being is about 100 and 150 mils of grapefruit juice every day will mean that this won't be cleared as well, and you're more likely to get that muscle ache side effect.
Okay.
Do you think you'll be able to have a different fruit juice?
Is orange juice okay?
Orange juice would be absolutely fine.
Okay. That's
orange
fine.
or apple or anything.
Yeah. So I'll have to tell the wife then.
Yeah.
Yeah.
Okay. So having me told you a bit more about this, how do you feel about having to take this medicine?
I think I should be able to follow that. So with those type of tablets, just taking it last thing at night, that should be okay.
Okay.
Yeah.
just to make sure I've covered everything, I need to just want to run through the main points that I've talked about.
So I'm taking the Simvastatin for cholesterol. I should take it last thing at night. As a reminder, keep it in my bedside table and close to my book. And avoid grapefruit juice.
And to look out if you get that unexplained muscle ache.
Okay, that's fine. Yeah.
Good, excellent. Hand that over for you.
Thank you.
When you are trying to chunk, i.e. break up the information into smaller, manageable pieces, you need to be able to summarise that chunk into about 4 points, because this is all, realistically, we can expect our patients to remember. Checking can be a more challenging task. You essentially want to ask the person, do you understand? Many patients will want to please their healthcare professionals and will therefore automatically answer yes. Therefore, this is not always helpful to use within a consultation. Therefore, we need to try some alternative strategies to clarify and confirm that the patient has understood the information that we've given them. One approach is to use teach back. Teach back is where you get the patient to state back the key information that they have taken from what you've just said. It is important when using teach back that it's not a test of the patient, tell me what I've told you, but more try and make it into a test of you. For example, I've told you quite a lot of information. Can you just summarise the main things I've told you to ensure I've not missed anything? This makes it more a test of the practitioner rather than the patient. Another approach is using silence. You could start a sentence and hopefully the patient will finish it for you, demonstrating they have understood what you've previously said. For example, you're taking the metformin for, and hopefully the patient will then say, to help manage my diabetes, or whatever the information you told them before. The key thing when checking a patient's understanding is that it should be an active process on the part of the patient. They need to actively tell you the key information or what actions or things they're going to do to help you to confirm that they have understood what you've told them. It's important to remember that every patient is an individual. You may be dealing with a very experienced healthcare professional who's come to you for your advice, or a patient who is very little understanding of the healthcare environment. You will need to adjust your approaches and techniques for these different groups of patients. This will avoid you becoming patronising. But don't forget, whoever you're working with, it should still be an active process on the part of the patient. By using chunking and checking throughout your consultation, you're providing the chance for the patient to interact with you. This should give them plenty of opportunities, and you should provide them explicit opportunities to ask you questions if there is anything they want further clarification or have uncertainties about. Don't forget, you need to use your skills as a practitioner to be picking up on what they are actually saying and their non-verbal communication to identify if they may have unresolved questions or queries. From this video and the example clip, you have now seen the technique of using chunking and checking in a healthcare consultation. Chunking, where we break up the information or advice we need to give into smaller, manageable pieces of information, and checking, where we have an active process that checks whether the patient has understood the information we have given. Now go and try these in your own consultations. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page, and subscribe to these videos.